All right, so hi.
Hello.
Hi. I'm Magen Hughes, but most of you who do know me as Totenkopf or Toddy. And the title of today's talk is, Are You HIPAA to the Jive? What we're talking about today is, it's kind of a 101 talk. It's not for those who have been in the medical industry for years and years and years and are know all about the headache that is HIPAA compliance. We're going to be talking about what HIPAA is, more about Title II, which involves the security rule, the privacy rule, and all that jazz. We're going to talk a little bit about the metrics on breaches that happened last year to make the medical industry the most breached industry. And then we're going to wrap it up and do QA if we have any time. So, what is HIPAA? Well, the main purpose of HIPAA was to improve efficiency and effectiveness of the healthcare system by standardizing the electronic exchange of administrative and financial data. So it stands for the Health Insurance Portability and Accountability Act, created and regulated by the United States Department of Health and Human Services, and it was enacted on August 21st, 1996. And it's comprised of 5 major sections or rules. The one we are talking about, like I said, is Title II, which is preventing healthcare fraud and abuse, administrative simplification, and medical liability reform. The first rule is standards for electronic transactions. It standardizes how electronic healthcare transactions are stored. Originally, if you just did paper forms and paper records, this standard didn't apply to you, but it's now being forced on them by 2014 if they want government assistance. Otherwise, they don't get as much help as they did, so they're being pushed to the electronic form of records. There's the Unique Identifier Standards Rule. It assigns a 10-digit number to everybody, which is, that number is called the National Provider Identifier. And it's applied to all healthcare providers, plans, and clearinghouses who use electronic systems. And it's usually based on an employer's ID, tax ID, or an employee's ID number. And it's supposed to reduce confusion and error between healthcare organizations. So each organization isn't using a different 10-digit number for each person. There's the privacy rule. When most people mention HIPAA, they think about the privacy rule. Unlike the other section, the privacy rule applies to health information in any form, be it paper or electronic. It includes your entire medical record and your payments for medical care. So if you're late on a payment or anything like that, even though it's sent to the credit card company, that data is covered by HIPAA usually. There's the enforcement rule. It became effective in March 2006 and involves civil money penalties against those who violate any of Title II's rules, not just the privacy rule, but including all the others as well. Before this, though, only those who were non-compliant with the privacy rule were sued. This rule also details how an investigation should take place, how the penalty is determined, and how to appeal a ruling. The security rule is a set of general standards to be followed along with more specific safeguards. Most standards come with implementation specifications, and it comes with a matrix of what is required and what is addressable when it comes to covering an entity's security implementation. And next I'm going to go over the matrix here for some lulls. So first of all, what the fuck do they mean by addressable? When a part of a standards implementation is considered addressable, it means if they write a good enough excuse, they don't have to implement it. Yeah. Yay! Yay! So, oh, actually, oh man. Hold on, let me go back to that. So there's, when it's addressable, they can either implement the specification, not implement the specification, or implement one or more measure as an alternative to accomplishing the specification. So I don't know if you guys can see this. So security management process is all required, which is good. Risk analysis, risk management, security policies, all healthcare entities have to have these things. A security official like a CISO, that's required, yay.
Yay.
But then you get to workforce security, authorization and supervision, like who can go in and enter places where your records are stored. That's addressable. Workforce clearance procedure, that's addressable. Termination procedure, addressable. Access authorization, access establishment and modification, security reminders, protection from malicious software, login monitoring, password management, what else? Testing and revision procedure, and applications and data criticality analysis, all optional. And some more optional stuff. So there has to be facility access controls. All of it's addressable. What else? Disposal is required. That's good.
Sure.
Accountability and data backup and storage, addressable. Automatic log off, encryption and decryption, addressable. Because encryption's hard. We don't. They're doctors. We don't want to deal with that. They can barely write.
That's their encryption.
That's their
I'm not kidding. Security through obscurity. I'm really not kidding.
Now we're going to talk about some breaches because, just because something's HIPAA compliant, it means it's secure, right? That's Cab Calloway, by the way. When I was writing the CFP, I was listening to a lot of Cab Calloway. So last year, 150 covered entities experienced security breaches impacting 500 plus people in 2011. Cases under 500, affecting under 500 people, do not have to be publicly disclosed by the DHHS. That's down from 213 covered entities in 2010. Healthcare is responsible for 170 of the 480 breaches that were reported in 2011. Also, the first publicized case of a company being prosecuted for violating the security rule was in July 2006. Or, I'm sorry, that's miswritten. It was 2011. The rule that allowed prosecution for violating the security rule was 2006. So this is a chart of how many healthcare breaches there were over the years. Covered entities are much more concerned about compliancy than actual security. As long as they can keep getting their government check and their write-offs, they couldn't care less. They can choose to skip specifications if they can write a good enough reason not to do it, if it's considered addressable by the DHHS. And despite experiencing more breaches, healthcare providers feel that they are more secure now than they were before. And that's the survey results for the charts I'm going to show you here. So here's some areas in which deficiencies were identified in risk analysis. Most of the problem was in security policy and procedure. Most places had none. Followed by physical security, technical IT security measure. Actually, hold on, I need some water. Items that most puts data at risk. Lack of staff attention to policy, which is a huge theme this year at DerbyCon, in case you haven't noticed, was user awareness. Data leaked in a breach includes a patient's name, their date of birth, demographic information, high-level patient information, in-depth patient information like blood type, specific ailments, mailing address, insurance information, and your social security number.
Do anything with all that, can you?
Actually, you can do more by stealing someone's health record than you can with their credit card.
Yep.
I can make you officially dead. if I had your healthcare record.
I'm what?
Here they cancel your credit cards out.
Sources of breach. Unauthorized access by employees. Unauthorized access to paper records. Laptop and handheld device. You know, people going on vacation, not encrypting their data and having their laptops stolen. Or people breaking into areas, stealing laptops that weren't encrypted because it's not required. Data stored off-site, like vendors. Improper destruction of records and electronic media. And network breaches. Usually, the perpetrator of a security breach is an employee. A person not associated with the organization is about 20%. Third party would be, you know, us hackers, a contractor, and then finally a former employee. So, covered entities need to implement a training program. Perform penetration tests and other assessments that go beyond what is required for compliance. Check IDs. Have your staff wear badges. Just because it's addressable by HIPAA does not mean you should skip it. Use common sense. Assess the risk, vulnerabilities, and safeguards on all systems containing patient data. Like I said, you shouldn't skip something because it's addressable. Pretend like nothing happened after a breach. Actually, there are fines now that were, it was just added, or not just added, but in HIPAA, if you fail to report a breach, you get fined, just like the hospital or health insurance company does, and you can get fined for up to $100 per person. Don't blindly trust vendors and contractors that have access to or house patient data, or invest in something because it's new or has blinking lights.
It's shiny.
And that's it.
Yay.
Yeah.
Me? Okay. I had a question. Well, a question and a comment that you were proposing remedies at the end there about what covered entities should do, but kind of the other theme of DerbyCon has been that which is incentivized is what's done. So if they have no incentive to do better, how can we realistically expect them to?
Well, the government's tried to incentivize it, you know, saying, if you do this, we'll increase the amount of money that you can write off for providing care to these Medicaid patients. But sometimes incentivization isn't enough. Yeah.
Sorry, I will add a comment because I have actually gone through this. It isn't enough. It's meaningful use dollars, and what it basically does is we'll give you piles of money if you reach everything and you don't have a lot of addressable items. I've gone through 3 customer implementations that got dropped on the floor and they lost money because they refused to do it.
Yeah.
Is that true?
Most places just do the required items because beyond that it's too expensive, especially these smaller doctor's offices, the county or the small city or county hospitals. They can't afford to implement some of these controls, and they use that as a crutch and excuse not to protect your data better. Adam.
I was just curious. I don't want to put you on the spot. I'm curious if I've heard the metrics on the street value for a credit card versus a medical record. I wasn't sure if you knew that, because people should realize.
I actually don't know the street value.
It's 5 to like 40.
Yeah, it's huge.
It's $40. It's 40 for a healthcare record, 5 for a credit card. Credit card I see for like $1 now.
And that's close to what I've heard, and people don't realize this. I did not know this. I'm now working in the industry that I'm hearing that, and that's a major deal. That stuff is more stolen than credit cards, and credit cards stolen like crazy.
Right.
So that is.
I mean, people think this is a fringe event when your health record's stolen, but it's a lot more common than you would really be led to believe, and it has greater repercussions. Did you have a question?
I did. So, but I want to add something to that too. Is there's also an identity with validated medical insurance as part of the IDs that are being sold online that are more valuable than an ID with a validated PayPal account or something like that.
Yeah, a copy of a birth certificate, which is easily accessible, is worth a lot more than like a credit card, right? Because a credit card, someone's going to report it. It's going to be reported stolen. Once you mess with someone's identity, you're.
So my question is, it's been out for a while. We're not seeing a decrease in breaches and things like that. Do you see it getting revised or revisions, such as like a PCI 2?
Unfortunately, I think it's going to get worse before it gets better. I was talking to Ben 10, who's been in the medical field for 11 years, whereas I'm like a complete noob. And he was telling me that they're now working on making all healthcare records, put them on a publicly facing internet website.
Awesome.
So you can easily access it and send it over to your other doctor. So doesn't that just make you feel warm and fuzzy, that knowing that, these people who were the most breached in 2011 are going to create a website where they're going to house all of your data and you or anyone else can access it.
It's fun.
I think that's actually a really good thing, because it's going to incentivize, because everyone's data is going to be breached. The cost is going to go way down for those things. So when an ID is worth like $2, yeah.
Do you work in government?
Maybe.
Yes.
I actually work in the healthcare industry for a pretty large hospital in the Cleveland area.
Mm-hmm.
And it's not just healthcare industry, it's also the vendors that are out there supporting it. In fact, I've got one vendor who wants me to put a production database server in a DMZ so that support staff can access it. And I said, absolutely not.
Yeah,
That's a battle.
it should stay right, because your risk program says, fuck you, no, go find another vendor.
Exactly.
Right, once we start pushing back on the vendors, you're not gonna have that problem.
Right, but also a lot of people, like a lot of the smaller hospitals especially, don't realize that's a bad idea. That's just, you should not do that. So they need more people to go out there and approach them and be like, here, this is what you need to do. Screw what HIPAA says, that's a nice starting point, but you need more. Yes.
Not to knock vendors, I'm sure we have people here, but yeah, like the people that I've talked to, when I ask how do you know what to do, what process do you follow, whatever, it's the vendor gave us this, and this, they told us to do this, and this is what we do. Like you said, don't blindly trust them, but
Right.
that's a massive thing, because these,
No offense to any of the vendors here, but they'll gladly sell you snake oil
Yep,
if they think that you'll take it.
welcome to the internet.
Does HIPAA push the burden of the punishments back not just on the immediate source, but like if it's because the vendor provided a tool which is fairly inherently, so the vendors have no incentive to meet this compliance. It stops right at the provider.
It stops at the covered entity.
They
Yep.
wash their hands of it, they're not responsible.
It's the covered entity's fault for listening to the vendor, so
So-
they're responsible for it.
Are any covered entities pushing for, look, we want you to take some responsibility for what we're responsible for, or, we'd like your design to meet some kind of standard reference design for how to implement these things?
Not a lot of places have been pushing back. As a matter of fact, when they get hit with a HIPAA suit, they want it to go away as quickly as possible, so 9 times out of 10, they'll settle out of court. There was a healthcare facility in Boston that settled for $1.7 million out of court. Another one in Alaska for $1.5 million, just so that they wouldn't get as big of a black eye. Yeah, Cindy?
So is the HITECH Act supposed to help with any of that, because it expands what the covered entity is actually, what it involves?
So,
Supposed to, right?
right. The HITECH Act is supposed to help some of that, but we won't know until it's like in full effect and we see how they act with it. But I mean, you can slap a whole bunch of new rules on stuff and it won't do anything. I mean, case in point, the TSA.
And that's just it, right? To have if you don't read your contract before you say it's illegal, you're done.
Right.
We have more unicorn.
And
Yeah, so what I didn't realize until about 2 months ago, my cousin picked up this job working for a healthcare company where all she does is answer phones from their customers. So they gave her their entire customer database and put it on her computer at home so that she could have access. I don't even know.
was it encrypted?
I give you $100
No,
to give it to me.
not even encrypted. So that she could have access, and what she does is she just sits there at home and she answers the phone when it rings and talks to customers about their health care. about what they're, what they have as far as their this, their that, and the other. And I was like, wait, it's in your house?
Yeah, a
like
lot of
with all your
people-
kids and your husband and
roaming
your friends
nurses.
and-
Roaming nurses have the same luxury.
Exactly. I was like,
Well,
oh,
the internet.
okay.
A lot of people, non-technical, non-security people hear HIPAA compliant, oh, we're HIPAA compliant. They'll see, oh, we, care about your rights that are covered under the HIPAA Act. And they feel warm and fuzzy because they have that piece of paper saying, I'm protected, I'm okay. And then they don't hear about healthcare industry being the most breached last year.
Of the healthcare companies that I've worked with, the mentality is always just, we don't have any money, we're too busy.
Right.
Woe is us,
We're more focused on saving lives than that security
It's
stuff.
patient care.
Yeah, and I know there's been a lot of themes today, this weekend, of don't blame the users, but I'm sorry if there's any doctors in the room.
Well, it's
but
not
doctors
just-
and users are awful. Like if I follow the rules, people will die, and you can't enforce it.
Right, but it's not just the doctors or the nurses, that need to be held accountable for it. The patients, they need to know enough to push back to say, how are you protecting my data? If doctors hear that they're losing business because patients aren't comfortable with the APT unicorn protecting them, then they're going to start implementing more controls because they don't want to lose the business.
Yep.
That's good for doctors. Hospitals, that
Now,
way,
hospitals-
I can't choose where I'm going to go when
Right.
I'm dying. If I'm in an ambulance, at least.
Turn
Right.
left.
In a hospital? No, they're not. They're HIPAA compliant only. I don't want to go there.
So that is a
Right,
thing. It's
that's-
a hard problem.
Right. Once you hit the hospital
It's not.
level,
It's not.
hospitals care a lot less than small doctor offices do, though.
It's like a captive audience.
She's right. Hospitals care less than doctors' offices.
I mean, they're privately owned, usually by people with deep pockets, and they're like, oh, well, we can take care of this with money. If someone sues us for whatever reason, insurance will cover it.
And a hospital.
Well, and the company that my cousin works for is actually like a major medical company, like
Okay,
Care
$200
First,
for the name.
like Care First Blue Cross, that
Is
kind
it
of
really
thing.
your cousin?
She is. She's my cousin. Well, my cousin's wife.
Bob.
Okay. My cousin's wife. Yeah, but I mean, this is a major medical company that they don't want to pay employees to sit in an office
It's
all
roaming
day
nurses,
and
I
take
know.
maybe 10 to 15 phone calls a day. So they'll outsource it, and so she gets paid by the phone call. She doesn't
Right.
get paid like all day long.
A lot
to
of
sit
patients
there.
don't realize they're just dollar signs walking
Yeah.
around. They don't care about you personally or your data. Well, okay, that's a little harsh. A lot of places don't care about you or your data. I'm sure there's some good medical offices there that do take good care, but they're not getting enough recognition. If we push or we shine a light on those people who do a good job of protecting patient data and use them as an example, that could probably help take some, positive and negative reinforcement there. Yeah.
I guess a lot of people here are from the healthcare industry, and I'm still kind of new at this, but
I'm gonna
can
get so
anyone
much
give
hate
me,
mail.
anyone had any success training nurses on protecting healthcare? Because as an IT guy, I try to talk to a nurse, and because I'm not a nurse,
Have you tried
I
to
get thrown
herd
out the door.
cats?
Yeah.
Same way. Anyone
Yeah,
got
it's
any policies
a
of
little
action?
hard
Yes.
training nurses
Yeah,
because
I
they're
can.
so
Yes.
mind
Don't
boggled.
talk to me, please.
Yeah.
Yeah, we've
find
had
you guys
really
after
good
this.
success just starting with the computer on wheels procedures and practices. And a lot of it is I've heard the comment in here, you can't train doctors, you can't train nurses to do this stuff because it's like it gets in the way of saving lives.
Sure.
There's the feedback on this, at least from my perspective, is okay. Does that also mean, because one thing we don't do introspectively, and this has also been touched on this weekend, is it because, are we actually getting in the way of doing this, and is there an effective compromise that can be worked out? Was it Painter was saying, we're the security sheriff, we say no. But does that mean that they really aren't getting their job done, and do we have to go back and revise it? And I don't see that revision process, and where I'm at, we do a lot of outsourcing stuff. We actually go back through and figure out what works best on a case-by-case basis. There's
Right,
a
and I'm not
one-size-fits-all
just
mentality.
and I'm not just damning privately owned hospitals and such. My Totem dad actually works at a veterans hospital, and growing up there, I would walk around, and he would have me check inventory on all the computers. You would be surprised at how many were left unlocked and open, because when they're in a hurry and they want to take notes because they want to get it out of their head as quickly as possible, it's just too much to lock their machine and unlock it. So it's not just privately owned hospitals who are making money off of their patients, it's also government-run hospitals who are doing these things.
Now, listening to my cousin's brother, whatever, I work for a major medical insurance company in Louisville that will remain nameless, but most of the buildings downtown. I can't say your name. If you are going to be working from home, we do have a lot of people, nurses, a lot of people that work from home. Before you get to work from home, you're issued a computer. A technician comes to your home. A technician runs a separate phone line to your home with a separate modem, connection device, VPN, the whole works to your home. And then make sure that if your door does not have a padlock on it, they add a padlock to the door in your house to bolt your door.
Also,
you're really serious about that stuff.
Yeah, and that's great. But there's also a new possible point of failure emerging, and that's mobile devices. You know, the whole BYOD thing. Doctors, they want to be connected all the time.
Yeah.
They have their iPhones, their Blackberries and stuff with all of their calendars, and what if they get a text message saying, oh, Mrs. So-and-so is here for her, I don't know, look at her her lady bits, you know, and it's on a text message. So the nurse who sent the text message, the doctor who received the text message, and the telecommunications company all have a copy talking about Mrs. So-and-so's lady bits.
Right.
Secure messaging.
Right.
All the keys,
And the medical, or not the medical, but the telecommunication company isn't bound by HIPAA at all. So, I heard a question. Yeah.
Well,
or not heard, but
I had another comment on this because, as many people know, I'm into the radio stuff and I like to scan around. And I won't name the hospital or the location, but I was just wandering around scanning one day, and I was hearing traffic in the clear on the radios from the transporter drivers, like that they'll go pick up a patient who doesn't drive or can't drive and just bring them to the hospital for a test or procedure or whatever they're coming in for, doctor's appointment.
now that's fun, because if I hear that so-and-so's out at a doctor's visit, I can break into their house while they're gone.
Well,
now that has nothing to do with their
they may
electronic
not know
health
that.
records,
They,
but
somebody may not know that data, but I know from what
I would.
both my parents are nurses, and I knew what the privacy laws were when I was growing up. Like my dad would often say, like, I can either tell you, somebody you know is in the hospital, or I can tell you about this anonymous patient in the case that we're working on, but I can't tell you so-and-so has this medical issue in the hospital right now. And these people were like, oh yeah, so, Mr. Smith, we need to drop him off for his EKG and all this other stuff, and I'm like, I can know now from that.
drivers and nurses, like, oh my God, nurses gossip. Guys, oh my God, if you fart weird, the nurses will talk about it in the cafeteria half an hour later, if that. No offense to the nurses, I'm sorry.
But what my point was that in this case, they didn't necessarily need secure communications. They needed to train these transport drivers to not, their only job is to take a person to this place.
So the transportation company isn't a covered entity. They're not bound by HIPAA.
But they're leaking information.
Right, exactly. They're a point of failure, but hospitals aren't realizing that. And I have a minute and a half, and Cindy's motioning at me.
At the same time, though, that same medical organization or the transportation organization, that information is provided to them by the patient. The patient has already released that information to them. And if they have not covered any kind of, if they haven't performed any kind of HIPAA training, which they're not required to, because they are not a covered entity, they can tell anybody. I've taken HIPAA training. I'm obligated under my current position to not say something to other people about medical conditions. So they have no obligation.
Thank you guys for coming. I'm Sorry for ranting, please don't send me hate mail.